Uh, Good afternoon. Welcome to Seniors 2021. This is Dr Ashley Dent's Healthy Aging Zoominar. Dr Ashley Dent has been a chiropractor for 11 years and has a particular interest in helping people who are aging and helping them be their best. So I'd like to hand over to Dr Ashley Dent, who will take you through the next 20 minutes or so. He's got some housekeeping to identify. So please enjoy.
Thank you, Dr. Crean. So it's our healthy aging workshop we're putting on for for Seniors Week, sorry. So a little bit of info about myself. My name's Dr. Ashley Dent from Launceston. Grew up in Launceston most of my life and went to Sydney to study the 5 years at Macquarie Uni. And then once we finished there, I moved back to Hobart and got a job with Dr. Crean here at Hobart and Kingston Chiropractic, and haven't looked back so far. I do quite a bit through our community and do a bit with our state association as well. So our national association, sorry, I'm one of the Tasmanian representatives. So a little bit of housekeeping. If you can just mute your microphones and switch off down the bottom here, switch off your videos. Just mute and switch off the video, that'd be great because it'll distract me quite a lot. And if you do have any questions, I won't see them till the end, but while you think of it, put it in the chat bar down the bottom. I'll get to them at the end and pop them there and I'll see them. That'll be really good. A little more housekeeping. We are recording this, and we'll put it up on YouTube in the next week or so. And we'll email out the video to anyone who signed up. And we will have an e-booking clinic. If you want to pop in and grab that, we can print that off for you and give it to you. We're happy to do that as well. And I already realised I'm speaking a bit quickly, so tell me to slow down. I will pop that in the questions there. I've got Dr. Crean on standby, going to tell me to slow it down a little bit, and I'll try and keep that in mind as I go. It's a known problem, and I'll work on it. So I'll try and talk about what we're going to cover today. Just in brief little generalities, we're talking about osteoarthritis. So what is it and what can you do about it? General benefits of exercise and stretching. So it's going to cover quite a few subtopics like bone density and muscle loss as we age. And hopefully I'll tie it all in together at the end there and make it a bit more user-friendly for you guys as well. So osteoarthritis, what is it? So if we look at these are x-rays of people's low back. They're obviously three separate people. We've got a younger, healthier spine here. We've got nice, clean vertebral. I hope that you can see my mouse moving here, by the way. Nice, clean vertebral bodies, nice and square. There's the disc spaces between the vertebrae are nice and wide and even. They're not wedged. And the joints are very clear and patent to the back here as well. We can see those very clearly. As we get over to the moderate arthritic change here, the joints at the back, they're not so healthy. They're a little more overgrown, and we can see they're not as clear up through there. And we can see this disc as well. There's almost no disc space left, and we can even see a bit of air in there called the vacuum phenomenon. A good sign, this L5S1 area is not very happy or has been under some duress for a while. And then we get to the advanced stages here. This is probably an older individual. We've got quite a lot of spurring off the vertebrae. The vertebrae don't stack nicely on top of each other. They're slipping around just a little bit, not unstable, but can move just a little bit within their normal bounds. And the joints are quite arthritic. Again, there's cysts down the bottom. There's not much of that left at all. These are osteoarthritic changes, so they're things that have changed over time. We call this the grey hair of the spine. A lot of this is normal, but there's a lot of things that happen around it that are painful and abnormal and affect people's quality of life. If you live long enough, you will expect to get some. I'll just, Dr. Crean, if you could mute your microphone, that'd be good. We know that osteoarthritis has genetic susceptibility, like a lot of conditions. Not everyone will get osteoarthritis, or everyone will at some point, but some people get it in their 30s. Some people won't get it till their 70s, 80s, 90s. And some people will have a lot with very minimal impact in their life, and some people can do a lot without getting a lot. So there's a lot of lifestyle factors that impact a genetic susceptibility for it, but it's not really a wear and tear. with some exceptions. I know my dad was a builder back in the days before nail guns. He's got quite a lot of osteoarthritis in his second knuckle from hammering up frames day in, day out, day in, day out. So that is a true wear and tear, and I see that now very regularly in older builders. They've all got an osteoarthritic second knuckle, you know. So a wear and tear is possible, but that's not the majority of what we see. We find that osteoarthritis is usually more prevalent in people who have been less active in their life, within reason. Again, someone playing AFL or combat sports, they might get some more than the average person. But generally for us average Joe Blows, wear and tear is not really the cause. It's not enough movement that does it. We know movement over a lifetime is the best prevention, to a point that you're not overdoing it. It's hard to know where that line is in the sand. But what does osteoarthritis actually do? What do you feel when you get osteoarthritis? Some of the earlier stages, you'll feel weakness. So if you have a knee osteoarthritic knee, getting up a high step or rising up off a chair starts to become hard. You feel like it's just you don't have the oomph to do it. It's not necessarily painful yet, the knee, but it's something the body's protecting it and doesn't let you use your full strength through that joint. And often that weakness is that first sign. Oftentimes that isn't evident until retrospect. You see that in the future and you say, oh, that gets painful now. And you go, yes, it's osteoarthritis. And you go, yes, it has been weak for the last couple of years. Later on, we do tend to see pain. Now, the process of developing osteoarthritis itself is not painful. It's a normal aging process within reason, but they are very prone to inflammatory responses. So if I had an osteoarthritic knee and a good knee and I start walking, so far down the track, my osteoarthritic knee will start to complain. It'll get inflamed. It'll get inflamed and will start to hurt at some point. If I keep going, if I just got a steroid injection in that knee and kept going, ignored it, my other knee will start to hurt as well. So it's not that the osteoarthritis is hurting, it's just it'll hurt more readily and more quickly. Much more common. So night pain is very common. If I do a longer walk on an arthritic knee, it'll tend to ache at night. There are things you can do about that, things like heat. Some people take Panadol Osteo, that's for a GP, they would organise that. But night pain is very common. It tends to not worry people as much in the day, but when you're trying to sleep and you're not moving around and distracted, the night pain becomes a bit more prevalent. Pain is not a foregone conclusion. I've seen quite a few people with significant osteoarthritic changes, and pain's not their main issue, stiffness is. Now, pain is common with osteoarthritis, doesn't have to be. Stiffness is very common. As that joint changes shape, osteoarthritis is a joint change, it just doesn't move as far as it used to because it's trying to stabilise itself. So there's a few things you can do just to test this out. And what we're looking for here is comfort and symmetry. So I'll see if I can set this up so you can actually see me do it. We'll do this first. Turning the neck. So if you just try this where you are, sitting comfortably upright, turn the head as far as you can to the left. What does that feel like? Is it comfortable? How far around does it go? Then compare it to the right. We go the other way and we say, yeah, hopefully I'm fairly even there. I feel a bit stiffer to the right perhaps, but it's quite comfortable for me. I'd be comfortable that my range of motion is within my age limits, but it's not perfect. How did you go? Was it comfortable? Was it even? What felt good? What felt bad? You can send us some info at the end, some questions at the end if you like. The next one, I'll see if I can do this with my microphone still there. Right? And you just bend down and touch your toes. So starting from an upright position, I'll bring that down for you, bending down. Can you touch the toes? And if not, what's limiting it? Is it back pain and discomfort, or is it just stiff and won't go further? Are the hamstrings pulling down the back of the thighs? If it's real just stiffness, that might be an indication there's something going on there as well. If you could never touch your toes since you're 5 years old, that's probably not the best test for you, but try it out anyway. How far down do you get? If you normally got mid shins and now you can't reach your knees, that's probably something you want to get checked out. The last one's a side bend, similar but standing again. So stand up off your chair. And again, I'll just move this a little bit so you can see where I'm going, hopefully. hand on your side of your thigh there, and just side bend your trunk. So I'm just running my hand down the side of my leg there. I get about to the crease of my knee. So I measure where I get to, the crease of my knee there. Then I go to the other side and I run down the same way. And that is not, I should have tested this out beforehand, I'll stop that swimming. Nowhere near, I'm probably 2 to 3 inches off my knee crease on that side. That's quite a significant difference there. I am noting there, as I do that, I feel a bit of a pull on the muscles on the other side there. It's probably muscular, but I'll get an adjustment today, maybe Dr. Green, if you've got time. That is quite a significant difference. 2 to 3 inches is quite a marked difference for that test. So if you do that one and you find that is quite uncomfortable in my back, mine's a bit more of a pull on the side of it. Is it back stiffness that's stopping that, or it just won't reach, even though it's not really uncomfortable? That's probably something you want to get checked out as well. So try those out. Turning the neck side to side, is it even and comfortable? Bend down, touch the toes. Is back stiffness stopping it? If it's back pain as well, obviously, we might be a good fit for you as well. And side bending, how far down does the hand go down the thigh? Measure it to the other side there. Again, is it comfortable? Now, it's working. There we go. Now, what can you do about arthritis? Now, we know if you already have bony arthritic changes, the research says we can't reverse those changes. But like I said before, the actual process of osteoarthritis isn't inherently painful. Other than stiffness, it's not necessarily a big deal until the joint starts saying ouch. So as chiropractors, we don't look to reverse those changes per se. We want to get that joint functioning better, make sure it's got the best chance it can to move properly and get all the right enrichment and blood flow, and hopefully not as inflamed as it used to in the past. We do have very good information for knee osteoarthritis. I'm circling that there. Cycling is really good for the knee. For most people, I should say. If you've got an arthritic knee and you haven't tried a stationary bike, you should try that. It's usually really good. Also, getting mobilisation, so getting a chiropractor or someone equivalent to mobilise your knee gently can be really beneficial as well. We can also give a lot of good advice around, modifying activities that might be aggravating, as well as giving you exercises that might be very beneficial. So exercise modification can help a lot. For a lot of people, walking can be okay, but there's usually a limit to that. It depends on which joint we're talking about. You can walk all day with an arthritic neck potentially, but a knee might pull you up. So I'm talking in very generalities here, but walking's usually okay for a knee, especially hips. They seem to enjoy it for most people. But spinal arthritis tends to like walking if you're not in that group that it aggravates. But maintaining mobility, stretching, mobilisation, very good for arthritic joints. That's the chiropractor's role, just making sure things are moving better. I did hear a good analogy of osteoarthritis is like a bit of a rusty hinge. If you don't move it around too much, it seizes up. If you keep moving or get to see the chiropractor, we move that hinge around a little bit, break up some of those adhesions or whatever we need to do, and you can maintain the mobility that way. That keeps you moving a little bit better. Now I just got to keep an eye on my time so I don't power through our time limits. So exercise is quite beneficial and has benefits in other areas as well. So we know obviously heart disease and cholesterol levels are managed very well with exercise. There's quite a lot of evidence for breast, prostate and colon cancer. If you increase your exercise levels, your rates of these diseases, as well as recurrence if you've had it and are in remission, drop dramatically. So breast, prostate, colon cancer, we know general exercise is very good for. Say obesity or increased weight gain, that's a no-brainer. The more you exercise, the better you'll feel in that regard. And type 2 diabetes. So if you're burning more blood sugar during the day, your diabetes scores tend to improve as well. Exercise alone in isolation for these 4 things is, maybe obesity. For the first 2 and then diabetes, probably not ideal for exercise alone, but with working with your GP or other specialists, you definitely want to look at exercise for those things as well. We know, I talked about osteoporosis and sarcopenia before, so that's the loss of bone density or loss of muscle mass as we age. These things are very normal with aging and unfortunately inevitable, but it can be offset a lot. How much do you lose up until you're 50 compared to how much you lose up until your 95th birthday can be dramatically different, or they can be very similar. So if you don't do a lot of exercise and you don't do a lot of movement, moving around, loss of muscle mass and loss of bone density will accelerate. We know you'll see more loss of bone density and muscle mass as you age. We do have a little, stay tuned later on, I'll put a link later if you haven't seen it. Dr. Sam's doing a exercise class at the end, about 2 p.m. I'll put a link at the end there. He's going to talk about mobility exercises and stuff like that too. But we know exercise is fantastic for these two inevitable processes, but can be massively off-put, and I'll show you some slides later of a lady who gets big changes with exercise. So this is I think it was a 70-year-old triathlete. So triathleticism would be cycling, running and swimming. Quite a big endurance sport. This person, I think, was a male, has done it their entire life, and this is a slice of their thighs on an MRI. So MRI, looking at the internal structures of the body. This is mid-thigh here. This is the bone. I hope you can see my mouse moving. This is the femur inside the thigh. Big, thick, wide bone here. White bone marrow. The fat shows up as white. Here's a lot of fat in bone marrow, as well as the under the skin, the subdermal fat around, and all the muscle mass inside here. Big quadricep muscle, big hamstring muscles. No fat, very little fat anyway. Little white streaks in some of these are very minimal, well within normal, very healthy muscle here. We compare that to someone on my next slide. Hopefully there it is. A similar age, was I right with the age? Let me move this. Yeah, 70-year-old sedentary person. So here we can see the femur inside that bone, mid-thigh MRI again. Very narrow compared to the thickness of the bone over here. Lot of this fat here, the white around is the fat, subdermal fat. A lot of fat around the muscle, under the skin. We don't mind fat there so much, that's too much, but that's where it's supposed to be. What we don't like is this fat within the muscle here. And we see this on a sedentary person, all this fat infiltrate around the muscle. We don't like seeing that so much. So this is a big contrast of someone who's exercised their entire life heavily and someone who's been very sedentary. Unfortunately, I have a little bit of bad news. This person on the left here can never get back to this again. They haven't done enough during their life to get to that point. But if this person on the research shows this person on the right, if they just stopped exercising and did nothing, they come about halfway back to what this person is. With bone density, loss of muscle mass, fat infiltrate. And if this person on the left starts exercising, they can get back up to that halfway mark too. So they can get very good, very good. They can reduce that. They'll obviously reduce their obesity levels. They'll increase their muscle mass, increase their bone density, as we saw before in the previous slides. And they'll remove some of this fat infiltrate that's sitting inside the muscle. If I go to the next slide, not quite this slide. So we know moderate exercise is beneficial at all stages of life. It really doesn't matter when you start. You just have to start at some point. What can you do? Walking's good. Faster paced is better, but that depends on your ability. Resistance exercises, so stretchy exercise bands, little hand weights, body weight exercises, chair exercises are really good for loss of bone mass, loss of bone density, and getting advice around mobility issues if you have something that's stopping you. If you say, I can't do that because of my hip, well, maybe you need to see a chiropractor to get that sorted so you can go and do some more exercises. There's lots of other people that can help you in that space. Rheumatologists might be, we work very closely with GPs or rheumatologists to help with specific joint issues. It really depends on where you are on that spectrum. A chiropractor is a good entry point. We might say, look, this is getting a little bit above our pay grade. Maybe we want a surgical consult, a rheumatologist consult, in which case we need to liaise with your GP or whatever we need to do to get you as mobile as you can be. But as a general rule, as manual therapists, as chiropractors are, getting you mobile and active and functioning well, that's our main role, and hopefully improving that arthritic change. So I mentioned it's very important to start at some point. This is 2 slices from the same woman. That's our MRI again, through the mid-thigh level. Before and after 12 weeks of resistance training. Now, this wasn't hardcore lifting big heavy weights. She was doing some gentle, I think she was just doing thigh extension exercises on a machine. So it's just straightening her knee on a machine. I don't recall how many times a week, but it wasn't arduous exercise. You can literally see her thighs a lot bigger. This is just the muscle growth. She's actually put a little extra fat around the outside of her. When they measure this, you can't really appreciate this very well on the imaging, but when they measured how much light and dark there was, she's put on a little extra weight around the outside, but she's lost a lot within the muscle fibers here. This little bit down here is outside the muscle, but within the muscle, they show statistically, she lost quite a lot of infiltrating fat. So you can see the muscle mass gain, that's quite significant. She also got extra bone density, and you can just see how much muscle's there. That's after literally 12 weeks only in a 92-year-old. So it doesn't matter. It doesn't matter when you start, it's irrelevant. You just got to start. It's better if you start earlier, obviously. Don't wait till you're 92 if you're not 92 yet. If you are 92, doesn't matter, get started. Walking, talk to a chiropractor, or if you are a little bit, if there is something limiting or stopping you, if you're worried about what you can and can't do, even if we can give you some encouragement that you can get out and do this stuff, I'm happy to do that, but get some advice if you feel apprehensive about doing some exercise. Balance is huge. We know as we age, there's a couple of physiological reasons, again, which are probably inevitable, that can be offset heavily if you exercise and do balance exercises. But we know if you score poorly on balance exercises at any age, but especially as we get older, falls risk gets higher. Now, if I fall or a child falls, my risk is fairly low of significant injury. But as we get into more senior years, that risk gets higher and higher and higher. Improving balance improves your falls risk. We've shown that unequivocally. There's a lot of ways you can do that. Balance exercises help, but it's not the only thing that helps. We know joint mobility is really important. If your brain knows where your ankles, hips, knees, and back are, you balance better. So if you feel like you're not balancing well, that's where you probably should get some advice. All the other stuff before are, what do you want? What do you want from your life? If you feel like you're not balancing well, I'd almost be, I want you to know that you probably should get that checked out. That's important. Only for that falls risk, if for not anything else. There's very standardized tests we do these days. How quickly can you get off a chair? How well can you stand with your feet together, with your eyes closed perhaps? And there's a few progressive exercises we can check. And we can rate how well or how poor you function there, and give you some exercises you can do. Look at your hip mobility, your back mobility, if it's needed, if it's an important part of that chain. But yeah, if your balance isn't great, you probably should have that assessed. So in summary, osteoarthritis isn't inherently painful, but it often ends up being. But there's a lot you can do to improve it. So whether that's seeing the chiropractor to help just that rusty hinge moving a bit better, helping you with the balance so you can move better. We know general exercise is fantastic for osteoarthritis. If, I'll put a little asterisk next to that, if the exercise isn't aggravating your arthritic joint. That should be a no-brainer. But teasing through what you can and can't do with a professional will be quite beneficial as well. Balance is a fantastic predictor of falls risk. And if you are scoring poorly on that, that is something you should get assessed just for your own safety's sake. You might actually be better than you think, but we've got very clear benchmarks these days. If you can't do this test to this number of seconds, we need to intervene. And what you're doing now, and what can you improve? So if you think, I'm not actually doing a lot, I can walk, but I'm not doing it because it's not part of my daily routine. Well, you can change that, then do it. Obviously, you want to do what's, you don't want to encroach on your quality of life too much. If you hate exercise, you probably should do it. It might be a bit of a chore, but you want to incorporate things in your life that are fun for you, not just a new chore. We've got a big catalogue of exercises you can do that you might say, I could do that. That's great. I didn't think of that as exercising, And like I said, if you do have things that you think I can't do that because of my knee, you probably should come and see someone and get it sorted out. Just getting some chats here. So, can you touch your toes? I hope you tried those before. The hands down the leg. Is your neck rotation even? Is your side bending even? Is it all painless and comfortable to do? I didn't mention this with the balance, I forgot, sorry. the standard test, can you stand on one foot for a minute? Have 3 goes on it, on each foot. If you can't make 5 seconds on either foot, that's a big problem. Keep the eyes open, don't do that with the eyes shut. I'll show you that position actually. So standing with the hands just off the hips and standing with a foot off the ground. Can you see that? Stand with your foot up off the ground for 1 minute without any big sort of, big jerks to the side. If you cannot do that for 5 seconds after 3 attempts, I would strongly suggest you get that checked out. That is one of those important ones that is a bit of a stop moment for us. We say we need to intervene, not just in the chiropractic spine end of things and hips and knees, but we need to do balance exercises for you, because that's something that really needs to be improved. And can you confidently and strongly rise from your chair? So do you have to climb up the legs to get up the chair, or do you need, if you sit down, are you looking for the chair that's got the handles on it to stand up? If you find you just can't do that, you think, oh no, I'm fine, but no, I can't actually get up without supporting myself. I can't just rise off the chair. It's probably a sign that something's wrong in that chain, not necessarily osteoarthritis. And it could be a hip flexor issue or hamstring issue or buttock muscle issue or back issue. We don't know until we look at you, but it is probably a good indicator that there's something, it's an issue with the joints like osteoarthritis potentially, but you should be able to, depending on age, should be able to fairly comfortably rise from a chair without having to climb up your thighs or hang on to some armrests as well. So what do we do as chiropractors? So a lot of us, we work with the bones, joints and ligaments and the muscles of the body. Most of that's through the nervous system. We stimulate that as part of our process. Our main role is to keep people mobile and increase their mobility. So we know that you can keep yourself healthy by moving. It's our job to keep you moving. If you find that something's limiting you and you can't do it, then that's what we want to do. Part of that will be pain reduction. If you have like I said, osteoarthritis, not a painful process, but if an osteoarthritic joint is painful, that's where we come in. We can't treat the osteoarthritis per se, but we can hopefully stop it hurting, get you more mobile so you can walk more, get on the exercise bike, whatever it is that you need to do to manage that joint. It's our job to help you do that. A lot of it, we work with the spine mostly, but we do deal with all joints of the body. Anywhere there's a joint, we can have an effect. We do that through gentle manual therapy. We can be gentle or firm, and we tailor that to the person. If you find if you think you don't want the hard stuff, that's fine. We tailor stuff to your wants and needs, and obviously to your strength levels as well. So what I do on a 90-year-old person is not what I do on a 22-year-old AFL runner. We also do a lot of rehab as well. If you have an issue around a hip or knee, that often needs some exercises. See some questions coming in. Sorry, bear with me. No, sorry. We do exercises around spinal issues or hip or knee issues, and soft tissue massage, stretching, whatever we need to do there as well to get the muscles more compliant as well. Exercise and lifestyle advice is a big part of what we do too. So we know, like I said, we can't treat the osteoarthritis directly. We can give you the lifestyle advice you need to help manage that at your own pace. That's a big part of it. It's not just the hands-on stuff, it's making sure you understand what's happening around that hip, knee, back, whatever it is, and what you can do in your own day-to-day stuff to manage it as well. And I mentioned that before, if you just want some motivation, come and talk to us as well. If you feel like you're worried that you're going to hurt yourself, we can provide you some certainty that what you're doing is correct, or yes, maybe you do need some help. All right, now I did mention the next workshop as well with Dr. Sam, who's doing some exercises. I'll leave this slide up for a minute, hopefully. Take a shot with your phone before it disappears. He's going to be doing some age-appropriate exercises, stuff you can do over a broad spectrum of things. There's a couple of ways you can. Now, you won't be able to click this link through Zoom, can you? I don't think you can. But you can take a photo with a phone and type it into your taskbar at the top there, or if you're in here, you've already seen, you know how to use Zoom. Use the meeting ID here, and there's the passcode for Sam's one at 2 o'clock in about 20 minutes. So feel free to jump on there, and Sam will give you all the advice you need around exercises as well. I don't have any more questions there, I don't think. Great. Okay, we're going to pop this up on YouTube for you as well within the next week, I mentioned. There will be a comment section there too. So if you do find you get some, I'm getting more messages here, sorry, another one popped through. Take-home messages I was asked for. Yes, take-home messages at the start there. Yeah, where did I put that? I'll come back to it. I lost it. How far up was it? There we go. Yes, so yeah, the take-home messages there was the osteoarthritis isn't inherently painful, but it does become painful for most people. Everything you can do to improve it, I ran through that. So exercise, seeing a chiropractor if you have issues there. Those tests I gave you before, try those out. If you're finding imbalances or pain or discomfort, make sure you do those as well and seek help if you find them. Those balance exercises I mentioned as well. If you do score less than 5 seconds after 3 goes, standing on 1 foot, you probably should seek help, definitely do. And general exercise is fantastic for osteoarthritis if you can manage it. Seek help if you can't. And just have a look at what you're doing now and what you can do to improve it. Yes, Dr. Crean, that'd be good if you could. I'm just about finished, so I'll sign off, I think. We've got no more questions coming through. And I'll hand you back over to Dr. Crean. Thank you.
Thanks, Dr. Dent. What I think we have had is a very informative and useful conversation around arthritis and some of the good reasons why we can be proactive, why exercise is helpful. And I think certainly Dr. Dent articulates beautifully the things that chiropractors can do that are unique about this. Now, I'd suggest a little homework for everyone who's is watching, and that is dialing into our website, which is www.hobartchiropractic.com.au. And there is a section there specifically on arthritis and back pain and neck pain. If you scroll down to the bottom of the homepage, there's a link on YouTube. And if you click on that, it'll take you through to our YouTube channel and all of the healthy, useful information about arthritis, aging, and that will be there in due course. So thank you very much. Have a good day.
Thanks, everyone.